answer is no, not only gay men. However, 1980, in the United States, the pound for HIV positive people, or very young, the adult male, was found very the strain disease which we call the opportunistic infection. Opportunistic infection is the immune system is low, otherwise won't get it. For example, PCP, the pneumocystic pneumonia, is not the regular disease in patient with or person with a high CD4 count. So they found it. Very young, the man who's not supposed to have a disease, however, the gay man has some the strange opportunistic infection. They thought, hey, this is the gay man disease. The reason why they found it is 1980, in the year of the 1980, they found it. However, about 10 years ago, 1970 to 1979, 80, what was happened in the world? Any of the countries communicate with each other, much less the borders to back and forth, back and forth. So a lot of the people goes in, goes out, and also the hippies, and no marriage for the singles, whatever. Then they found it. However, it was under the ground for the female or male and female, the section was going on. In 1980, the President Reagan is discriminating those people. Hey, let them get out here and put it in the South Pole, North Pole, or Alaska. So they thought that this is a gay man disease, but it is not. That you found it, so that answer is no. Okay, next slide, please. This is affected the vulnerable people, something like I said, not only gay men, but also heterosexual. And this is the MSM, the man, sex with a man. Something like a strange disease, strange the group. Even they do not, men have a sex with a man. We call them also the gay men. The gay men is not all, the people 100% does the sexual activity. They want to live together. They want to live, help each other. Without the sex, still they call the gay men, or the men who have a sex with men. In my university in New York, the Columbia University, there is a famous gay man is there. Literature Nobel Prize, Silent Stecker, Ronald the King. They are gay. But they live together with another partner, like a wife. I don't know which is the wife. But the man who have sex or not, who doesn't have a sex with a man, they live together, they go to the gay man. Then the gay man is not only person to be affected with HIV, the heterosexual, and also the commercial sex worker, male and female is the same thing. And transgender. You know the transgender is? Anybody? Transgender is, looks like a man. Even there. It's a different, right, for man and a woman. But even looks like a man, like me, even here, but doesn't feel man. Something like a behavior as a woman. That we call the transgender. And a lot of the famous people are there. They want to be a woman. They chop it off and make up the hole to do a sexual activity. That type of the man is also transgender and also a prisoner. Prisoner is isolated, the people, right? Then not man and woman together. Man only big cell. and they are very frustrated to do a sexual activity, so they do some kind of sexual intercourse. That's the reason to be infected. Okay, next slide. So the answer is actually is not only gay men, all the populations. But this behavior, this factor is gay men, heterosexual, the prisoner, the IV drug user, the transgender, something. Alright? So if answer is correct, so I will count it the circle. If not correct, right? And this was I presented a long time ago in the sessions. And how many people living in the world? It is about only the 37 million. It is huge number. Alright? So others is 25 million or 3.5 million. The answer is 36 million. Huh? Okay. Right? Next slide. This is the reason for the 36 million or 37 million. About the 2017, 195 the country was registered and they reported for how many HIV people are there or infected people are there. About the 165, 1/4 of the country is in Africa. It is a huge number in Africa. So not only, 59, not our country, is our country here. And also the 1.5 million are children, or less than 15 years. So we have a huge number of, and also newborns. That's right. And you can see, these are maps. This is Africa. Yellow is less, and red is more. So total population in about the 37 million is located, 50% or a little bit more is located in our country here. The Sub-Saharan, not many people are living, that's why. So we are very pandemic HIV in African countries. Next slide. Okay, so circle or whatever, don't look. And how can you tell that somebody has HIV or AIDS? Are you AIDS? Yeah, look like AIDS. Oh, look like no. Is it easy to say? No. Okay, next slide, please. Yeah, there is no easy way to tell. Yeah, there was long time ago. When they don't have a medicine, they develop the kaposi sarcoma and the cancer in the skin all over. Oh, we can see, yeah. Something like that. Right? So, unless such type of the symptom is not seen, we are not able to say, easy to say, he is HIV infected or not. Okay? Next slide, please. Can you get the AIDS from the sharing the cup? An infected person? Are you sure? No? Yes or no, or only if you don't wash the cup. Next slide, please. Answer is no. Of course not. Huh? I can tell you the reasons. Next slide, please. I don't know if we have a... Okay. This is a high risk behavior. The HIV can be transmitted by sexual contact, man and man, or man and woman, or woman and woman. They are transmitted each other. I'm alone, so I don't get any HIV now. This is the needle, and also next one is vertical transmission from mother to child, but not in the uterus. When they come out, it's a birth canal, it's a position to be infected. And also, right? Yeah. And it is not easy to see. What is this? and this is the man, and this is the insect or animals or a toilet. I tell you the truth according to our research a long time ago. If I am HIV positive, let's say, and I cut the blood is here, if touching it might be infected. Why? Okay, this blood was, let's say, 3 days ago. Huh? Oh, if you see that if I have an openness or a person touches the openness, at least HIV, the virus in the blood, has to get into our bloodstream, not touching here. And also, after the HIV infectivity is only 1.2 days. So after 1.2 days, this HIV cannot destroy, get into, but not destroy the other CD4. Infectivity means virus get into a body, and within the 1.2 days, they have to go to the lymphocytes. The lymphocytes will produce, but they lose the infectivity. That's why even the chair, the toilet, should be okay. Next slide. When term AIDS was defined? 1977, 87,
Yes.
or 82?
87.
Okay, next slide, please. Yes. This is, I doubt it, actually. 1982, but if someone else make it 83 or 84. Anyone? None of the answer. According to, they know it, they hide it. Export to the society is actually 83. 1983. The CDC in the United States or National Institute of it's okay. And also another institute in France, Pasteur. Pasteur Institute found some virus which is a cause of the AIDS. They call the lymphoadenopathy virus, LAV, which is lymphoid disorder. Many of the French people or European, their laymen has some problem for the lymphoadenopathy. That's why they call lymphoadenopathy associated disease, associated virus, LAV. That was found in 1983. But people know before make announcements. In the United States, the NIH, National Institute of the Health, Dr. Fauci, Dr. Garro. Dr. Garro announced it in 1983 also, same time, they all to compete. We found it, something else. But 83, they call human leukemia, human T lymphocyte leukemia. It was the same virus with LAV from the Pasteur Institute. So they negotiated to make it the same name. They called the human immunodeficiency virus. It was 3. But it is okay when the 82, right?
Yes.
Make us up. Next slide, please. But okay. Previous one, sorry. Okay, it is true. When was the time HIV/AIDS was defined? It is in here because the patient was huge increase of the number of the patients in 1980. However, even though 20, 30 years ago, which means 1950, many of the laymen society are closed society. No one can get out. No one can get exposed to the other society. The people with the laymen was hiding or under the table the community. Even they died with HIV or looks like HIV, they keep quiet. one of the famous the music, the Tchaikovsky. He's a gay, very famous gay, 1940 something. And before. And also he passed away by the Kaposi sarcoma. But nobody knows. So a lot of the people they passed away even before. So HIV could be present in long time before the 1980s. Next slide. Okay, next is how protected do you use the most against the HIV infections? Condoms or contraceptive pills or the Jerry answer is next slide please. Yes, it is condom, but latex. In the beginning, first the condom in this world or in the earth. You know what kind of the materials was used to use the condom? What? They want to do, but they don't want to get pregnant. That's why they broke the condom. Right? Yeah. So what kind of the material? They don't have a latex. The 17th century or 19th century, 18th century. They don't have a condom, latex condom. Condom must be latex. Used for, you go to the supermarket. There is a sausage there is a skin, right? That's the animal, the intestine. Animal intestine they use. You understand. They use instead of the latex condom, they want to use it. However, the biological materials have a small hole. Very tiny hole because it's the biological substance. So the HIV goes through. Very tiny. So that's the reason it has to be latex. Not regular, the previous old side of the condom. Alright, next slide please. And the condom. About the condom. I think I mentioned it in the lecture. There is, in a man or a woman has something like the fluid, liquid. The man contains, of course, for the vaginal liquid contains HIV. But most of the HIV is contained in the semen, but not in the sperm. The semen and sperm is there, but not in the sperm. They don't infect it to the sperm. They floating in the semen. However, I think you know that the man has, before the ejaculation, there is a pre-ejaculate solution, very tiny, that contains also the HIV. So, that case, when condom is protected, okay, only at time of the ejaculation. They insert almost, they put the condom, it is too late. From the beginning, even the pre-ejaculated the step, it has to be protected. After the ejaculation, immediately remove. Maybe man doesn't want to stay, but it has to be. It goes shrink and come out for the semen. That's the possibility or risk of the infections too. Alright, next. What are the specific symptoms of the AIDS? There are no specific symptoms. We can see it from the specific symptoms, something like the Kaposi sarcoma. But in general, we don't have it. Alright? Next slide, please. Okay, so what is the HIV? This is a very simple question. Virus, bacteria, fungus. We did it in the second time for the section, and a lot of the different microorganisms is here, and it is, answer is, next slide please. Next slide please. Are you okay? The virus. Virus is very, very, very small. And according to most recent, the coronavirus can go through the mouth, the mask. Okay, so the virus is the answer. Next slide, please. Can insect transmit HIV? Why? What about the malaria? They do. Mosquito bite? Bite? Tap? Yes. Why not HIV? Everybody knows why HIV does not transmitted by a mosquito. I don't. The mosquito, yes or no? Answer is? No. Okay, no. Next slide, please. Next slide, please. Okay, this is a mosquito they are sucking, and this is the mosquito inside. This is a needle. The needle sucks the blood, goes to their intestine or stomach, and intestine goes here. So, when we take some food, we digest it, right? So, digestive, then next one is goes back to the lymphatic and come back to, can you see, to here, out here. So that's why they are digested in here. So no HIV shape, cannot transmit it. You see, why when you get the mosquito bite, you have some, they injected saliva. They inject, when we suck the blood, no infections. When mosquito come and try to, before sucking for the blood, they put some saliva to the skin, make it numbness. That's why after that, some solutions or substance make it itchy. That's the reason. So, just sucking a blood, for example, needle to take it, we don't get the infection. However, infection is goes to sucking, goes to here, and digested. Before sucking, they put some some materials to make it numb on the skin. Then they suck the blood, goes through here, and next one goes through. However, the HIV cannot survive. The HIV will digest it in here. That's why even they return with the saliva to inject, it is not. However, malaria, the egg is not able to digest it and come back to here. That's the time to be infected malaria. Okay? Malaria is not the sucking of blood. When they put the saliva to skin, that's the time of the infection. However, the saliva doesn't contain HIV because already digested. But malaria is yes. That's why when you put the malaria, the saliva to here, malaria, the egg is coming. That's the reason for infection, the difference. Okay, next slide please. Okay, what does the STD stand for? This is easy, right? Next slide. Yeah, sexual transmitted disease and STD. And it's causing everything contains, that's right, the STDs, we will put it there. Okay, next slide please. Is there any cure for the AIDS? Answer is? No. Okay, next slide please. Yeah, it is true. Next slide please. As mentioned in the second or third sessions, amount of the lot of the type of the ARV was developed. The first developed was 1987 by the Dr. Mitsuya, the Japanese, was the developed. We worked together about when we made the ADC. Next slide please. And most recent one, the 2018 or 2019, we call the last effective medicine for the dolutegravir, one of the integration inhibitor. The most recent patients even our facility, about 80% or 70 to 80% of patients is taking for the DTG inclusion regimen, which is quite effective and easy to take, 1 pill a day. So this is however, these medicines, next slide please, these medicines are stopped. The next slide please. Just a stop for the replication. Once we get the virus stay in our lymphocyte, or actually the latent lymphocyte hiding in somewhere in your body, will stay more than 60 years. If no medicine is cannot eradicate or remove from our body for the rest of our life. But I don't know, 10 years later, there might be a medicine too. Alright? So, there is no cure. Okay, let's go. When is the World AIDS Day in health? January 1st or December 1st or the June 1st or July 29th? I didn't put the July 29th in here. It's a particular date, which is my birthday. Okay? Next. Answer is December 1st. Is the World AIDS Day. Alright? So, they use for, this red ribbon. You know the meaning of the red ribbon? Why they use red? What about the pink? Huh? Breast cancer. No? What about the blue? Something like a little bit darker blue. Blue ribbon. You know? That is the child abuse. Prevent the child abuse. Whatever. Okay, next slide please. Okay, red ribbon is stop the stigma or discrimination and support HIV/AIDS individuals. That's the agenda of this red ribbon. Red ribbon was used in Germany during the World War II to identify Jewish is here. Jewish is here. They put this ribbon. They will go to Auschwitz. They put the ribbon. Hey, Jewish, go. And you are German? Okay, go this. Jewish, go. That's a way to discriminate a person. They put the red ribbon. That's why they use to remove or decrease of discrimination against HIV. They put red ribbon in here. That's the reason for the red ribbon. Okay, next slide please. Worldwide HIV is the most common in which age range? 0 to 14 or 15 to 24 or 25 to 34?
15 to 24 years.
Next answer is 15 to 24. Yeah, they are quite sexually active. So I'm 35, so no problem to here. Okay? You marked it? Next slide please.